ladies and gentlemen. My name is Janet Johnson. I'm going to present to you about cancer. So some of you probably know what cancer is and what cancer do, but I'm going to go in a little bit in depth about cancer and what it does. Here's some handout so you can follow along with what I'm saying. Cancer affects about 3,000 or more women each hour, and not just women, men too. But it's a disease that is growing rapidly, and it's affecting a lot of people around the world. So it's not just in the United States; it's nationwide. So I'm gonna go in a little bit and talk about what it does, what cancer is, and the different stages of it, and how the disease progress. Let's start about talk about, if you can just imagine if one of your loved ones have cancer, how would you feel about it? And most people will say they don't know nothing about cancer because it doesn't affect nobody for them. They can't say anything about it. They don't know what it is. You just see people hear people say they have cancer, or their family members, a friend or relative have cancer, but nobody know exactly what it is. So I'm just going to go in depth and talk a little bit about what cancer is. Cancer is an uncontrolled growth of abnormal cells in our body. And it develops when the body normal control mechanism stop working. Old cells do not die, and instead it grows out of control, forming new abnormal cell, which is called mass or tissue. There's different type of cancer. You have leukemia, which is in the blood. You have lymphoma, which is in your immune system. You have the central nervous system, which it could affect your brain and your spinal cord, which those are worse because the survival for that is rare because it affects your nervous system and you can die fast for that. Most people, the last place where that happened, they die fast. Some people have surgery and it goes away, but take chemotherapy and stuff, but sometimes it doesn't help. To just go through the motion and die. How is cancer treated? Cancer is treated through surgery, chemotherapy using chemicals to kill the cancer cell, or radiation therapy using X-ray or to kill the cancer cell. Some people from the third world country try to use other herbs and stuff to try to cure cancer, but it doesn't work. You have to have either chemotherapy or surgery, and then it goes in remission. But most people live to tell the story at the end, some don't. So those who live to tell the story are lucky. Others are not that lucky. What can you do to manage the side effect of the cancer treatment? You need a lot of support from your family members. This is very important because you can have all the medical treatment. If you don't have the support, you don't have the strength and the will to fight. And if you don't have that, there's no use you trying to think, because without support, you can't make it on your own. And nutrition-wise, you have nutrition therapy to help prevent malnutrition, which you have to eat well, but with the medication you're taking and the therapy you're getting, it's hard for some people to eat. Imagine if you have like cancer in the lungs, how are you going to eat and swallow? So then they give you have either NG tube or a PEG tube, which helps supplements to go into the body and you can eat. But then with the medication make you nauseous. Some people, they get very nauseous, their hair fall out, the skin, they start to get reaction to the chemotherapy, and then they have to stop the chemo and then try a different chemo, or the doctors have to figure out what is best for you. Overall, having cancer is not an easy process. Many people, live with this disease and they have to overcome it. And it has different stages. You have first stage, if you get it in first or second stage, you're more likely to survive. The third and fourth stage, it's spread wide, so it's harder to control because the cells just keep growing. It's out of control. So a few cancer you can have is bladder cancer, head and neck, liver cancer, ovary cancer, prostate cancer, stomach cancer, breast cancer, which is most common in women. A lot of women have breast cancer. Prostate cancer is what a lot of men have developed when over the age of 40. That's why they say you have to go check your prostate. That's where the doctor go stick their fingers in your private booty, the guys. And with a woman, she has to go have her mammogram and her pap smear, which can prevent cancer in the esophagus, of the ovary, and breast cancer. The leukemia cancer, which is rare, but it's there. That's in your blood. That's something you can't control. So they have to treat you with different chemotherapy and sometimes bone marrow transfusion and all different stuff to help with that cancer. Skin cancer, which is rare, but a lot of people can't go too much in the sun, they get skin cancer. Most people from the third world country, they don't really get skin cancer, they're always in the sun, but the people that are not exposed to sun 24/7 a day always get, some of them get skin cancer. Overall, cancer is not an easy subject, and a lot of people don't want to really talk about it, but we have to educate ourselves about it. So I have explained what cancer is. It's an uncontrollable growth cell in the human body that can form a mass tissue which is called a tumor. We talk about the different stages of cancer: first stage, second stage, third stage, fourth stage, which is terminal, the third and the fourth. We talked about the different places you can get the cancer. We talk about leukemia, lymphoma, central nervous system, gastrointestinal, and all that. So just educate each other about cancer and what it can do to us, because you don't want, your family member to be in this kind of situation. And if they do, you know what to do to help them and support them. There's support group for cancer people. And after chemotherapy, some people go there to, talk about the issue to recuperate from cancer. But the most problem most people have with cancer is when they lose their hair. It's a hard process for a woman with long, nice, beautiful hair. She's bald-headed. The next couple days, all her hair fall out. So just educate each other about cancer and support each other. It might not be a family member, it might be somebody you work with. Just have a kind heart, and support them. Thank you, guys.
You're welcome.